as a family, as individuals, as you going through your treatment? Is that what gave you is that what gave you the idea of, I want to do something more and give back and with Salto Health, or how did that come about after your first company?
I'm sorry to hear what you went through and what so many families go through. And you're right. It's really kind of how Salto Health and Salto, just for people out there, the name Salto is actually a gymnastics term. It's a somersault. And when you hear the words, it's cancer, your life is turned upside down. And so I thought it kind of feels like a somersault where you're just turned upside down.
Yeah.
But I created Salto Health really because I spent the last 15 years immersed in the cancer community, talking with survivors and caregivers and nurse navigators, oncologists, nonprofits, associations. I mean, everyone involved with the whole spectrum. And I had gone from kind of both sides. My mother was initially diagnosed in 2008 with a different type of cancer than mine. And it was the first time that I had ever known anyone close to me that had been diagnosed with cancer. And it was a new world and a new vocabulary. And I didn't know how to help. What do I do?
Yeah.
And then from survivors, talking to so many thousands around the country over the years, I heard them reflect those same things that I was feeling. What do I need? The non-medical items, the things where when you go home from your appointment and you've got to live daily life, what are those things that can help? And so last summer, I really started putting this company together and saying, you know what? I want survivors to understand their non-medical needs and be able to easily access them. And I want loved ones and neighbors and caregivers and coworkers to understand how they can help. Because one of the worst things that you hear is those patients that a loved one comes or a neighbor comes over and says, let me know how I can help, and then walks away. And for the survivor who's already dealing with the mental, physical, logistical, financial, emotional load, they don't have the wherewithal to find one more thing to have you do to help them. And so instead, a lot of times survivors will just say, oh no, I'm fine, and then suffer in silence.